Big question I've actually been curious about, and I know it's really hot everywhere right now, is the drug Ozempic, otherwise known as semaglutide. It's being kind of touted as like the next generation weight loss medication. I've seen some pretty promising studies. There's even like celebrities that are now using it. I think Elon Musk was one that recently like had a big transformation on it. Kind of what are your thoughts on it? Where do you see its benefits? Maybe any drawbacks?
Yeah, so you're right. Semaglutide, Ozempic, it falls into a class of medications called GLP-1 agonists or glucagon-like peptide-1 agonists. This is something that is beneficial in multiple ways. There is a drug that's made for type 2 diabetes. It is an incretin, meaning that it increases the production of insulin. It can also help to repair the beta cells in the pancreas. So in type 2 diabetes, one of the issues is that the pancreas, which produces insulin, which helps the people to clear their glucose or utilize their glucose, the pancreas kind of burns out essentially. The beta cells that produce the insulin within the pancreas, they die out because they're kind of overused. Drugs like this can help to improve the quality of those beta cells and improve the production of insulin. So it will help people with diabetes who are no longer producing significant or adequate enough insulin to produce that insulin. In the peripheral tissues, it will also help the cells to be sensitized to insulin. So another part of diabetes is that your cells become resistant to insulin, or insulin resistance, which is a term that's thrown around a lot. And so not only does it improve your secretion of insulin, but it improves your utilization and your sensitivity to insulin. So that's how it works as like a type 2 diabetes drug. The other awesome benefit of it is that it's a potent appetite suppressant, and that's why it's now FDA approved for weight loss, and that's why so many people are using it everywhere, with a doctor, without a doctor, from every website, every corner of the earth. They're trying to find this stuff because it's so effective at weight loss. And then, like I said, it does that through potent appetite suppression. And it does that in two ways. One is in the brain, helps to reduce hunger signaling. And so you essentially don't feel hungry. You don't have cravings. You don't feel like you need to eat. A lot of hunger kind of stimulate or starts in our brain. And then it goes a step further for those who just kind of eat when they're not even hungry and mindlessly eat, which is a lot of people who suffer from things like obesity. It'll make us feel very full. So small amounts of food will give you the feeling of being extremely full and satiated. It does that through slowing your gastric emptying. So your stomach stays full longer. You don't get that motility as efficiently as previously. Which is one of the downsides. Probably the biggest downside that we see with it, and the biggest side effects come to GI upset. So that can be nausea, and the nausea is, as one could imagine, plays into the appetite suppression, because if you're feeling nauseous, you probably don't want to eat. That usually dissipates though after maybe a week or two of use, and most people report that it is pretty minor. But nausea is one of them. And then also it can cause either diarrhea or constipation. What we see probably more often is constipation, because that gastric motility has slowed down so much. So people kind of will deal with or suffer from a little bit of constipation while they're on it. So those would be the main ones. The scarier side effects would be that it has been linked to potentially a certain type of thyroid cancer, the medullary thyroid cancer, carcinoma, if I'm remembering that correctly. And from what I have gathered looking at the research, I don't believe it's actually ever been demonstrated in human models. It has been demonstrated though in animal models. And so the recommendations are that if you are somebody who has had that in the past, or if somebody in your family has had that, then you should probably stay away from these agents. So it's definitely something to consider before you just go online and order this from a research company, like a peptide or a SARM's place. Kind of question in your family, does anybody have this? And I would actually even argue probably don't order it off of any of these anyways, and only do it under the supervision of a physician. So yeah, those are some of the benefits and the downsides. There's also a few other really cool benefits to it that I don't think people are talking about. One is that it's been shown to be cardioprotective and help to improve our cardiovascular health. It does that through helping to enhance our left ventricular function. So that's a part of the heart that helps to pump blood. So it can actually help you to pump blood, and it reduces the vascular resistance. Vascular resistance, basically our body is filled with blood vessels. If there's a lot of resistance, our pressure can build up, and so it can actually help to reduce that vascular resistance, improve our blood pressure. So it may be cardioprotective. I think there's also some research showing that people taking semaglutide have less incidence of cardiovascular disease. So probably cardioprotective. There's also a good amount of research happening right now showing it may be protective against neurodegenerative diseases like Alzheimer's. And so it seems to have a lot of promise. And from anywhere from diabetes to obesity to neurodegeneration to cardiovascular disease, kind of seems like a wonder drug.
Absolutely, it does. And I think that's everybody nowadays always has their questions if something seems too good to be true. But no, I'm glad you highlighted all that, and talking about some of the downstream benefits there with the cardio protection and maybe even preventing against some neurodegradation as you get older. Is that kind of secondary, primary? What are kind of there as far as how that works? Because I know the cardio benefits could be just simply from losing weight and becoming more active, or is there actually anything directly that it's doing for the heart?
Yeah, I think it's both. I think obviously, as we improve insulin sensitivity and as we reduce adipose tissue or body fat, we're going to see a significant improvement in basically all symptoms or all systems of the body. And so I think that that's probably a big portion of it. However, though, the studies that were done took actual GLP-1, the peptide, and they gave large boluses of it into animal models, into the cardiovascular system, and they saw those immediate benefits on the ventricles and the vascular resistance that I talked about. So it seems to be like actually like a primarily affecting it, and not only secondary to the reduction in weight, which obviously has a plethora of benefit.
Absolutely. No, thank you. And kind of the other thing that I've seen as far as possibly maybe a con, or at least, others are throwing out there, is that, in some of these studies, it shows, they're not just losing fat. It's a lot of skeletal muscle or maybe even some bone mineral density. My argument against that is that a lot of these studies are with people that are pretty sedentary, very obese, not really following a resistance training program, or very strict exercise program alongside of this, and high protein diet, basic things that you would do to counteract some of that. Do you think that's probably why you see those at the end point of the study, or anything else there?
Yeah, I 100% agree. And as far as my opinion, I don't think there's anything inherent to semaglutide or any of the GLP-1 agonists that causes a increased reduction in protein or being muscle or bone mineral. I think what's likely happening is what you said, is the studies that are being done, or the majority of people taking it are taking it who are obese and do not have those lifestyles. What we've seen when we work with clients who are using this is these are clients who are utilizing it for getting ready for a bodybuilding show, or just to get leaner for the beach, things like that. And they're able to maintain a lot of muscle because they use the same principles that people who are cutting body fat, who are athletes, do all the time anyways. They increase their protein so that they have a larger reserve, so hopefully they don't start tapping into protein for fuel. And they also continue with the resistance training, so they lift heavy weights. I do personally feel like if people are using semaglutide, Ozempic, tirzepatide, Mounjaro, Wegovy, all of these, if they increase their protein and they start lifting, they're probably going to have much better results. They'll be able to maintain a lot more of that lean mass than they otherwise would.
Gotcha. No, that's great. I mean, and I'm glad you highlighted that, and because I've always kind of suspected that that's maybe the issue. And kind of I guess, what's the word I'm looking for? What I would use as an analogy to that would be like if you just went out and ran every day with no resistance training, and that was your only modality of losing weight. Sure, you would lose weight, but eventually some of that would be lean tissue, if you were not doing anything to counteract it. So yes, certainly don't think it's actually anything from the semaglutide itself probably contributing to that.
Yeah, I think probably the biggest thing for people to focus on when they're using something like Ozempic is make sure you hit those protein requirements, because, like we talked about, one of the biggest things that's going to happen is your appetite's going to decrease and you're going to feel overly full when you do eat. Protein can be very heavy and satiating as it is without having one of these medications in there. And so I'll tell people prioritize your protein first and maybe start looking towards some liquid sources of protein. So maybe start a meal with a protein shake, down a whey shake, so that you can get that in before you move on to your carbohydrates and your fats. Because what I'll see a lot of times is if somebody has their normal balanced plate, if they start eating the carbohydrates and fats first, they're going to get full really quickly and maybe leave the protein off. You can imagine when you're full, you don't want to be shoveling in some protein usually. So maybe prioritize when you're eating, try to be cognizant of this and prioritize that protein first.
Absolutely. No, great insight. Thank you.